Working together, social workers and libraries. In this part of our presentation, we will discuss examples of innovative community partnerships between libraries and social workers, specifically the program at Edmonton Public Library and the groundbreaking model for this type of service at San Francisco Public Library. The trend for the past 40 years toward deinstitutionalization of Canadians with mental illness has contributed to a steady increase in homelessness. Libraries in many cases are filling the role of day shelters, but in addition to providing warmth, safety, and bathrooms, the library's goal is to connect its homeless patrons to available community resources where their basic needs for food, shelter, hygiene, and medical attention can be addressed. To this end, several libraries have included social workers as full-time staff members. San Francisco Public Library was the first to implement an in-house social worker program in 2009. Working with the city's Department of Public Health and other social agencies, the library employs a full-time social worker who, with a community psychiatrist, provides training for library staff and assistance to the library's patrons experiencing homelessness. The social work team also includes health and safety associates, hired for 6 to 12-month internships. These are people who have experienced homelessness themselves and know how to navigate the system. They provide resources to library patrons, monitor bathrooms, and report any illegal activities, among other duties. Based loosely on the San Francisco program and working within its community-led service model, Edmonton Public Library implemented a library social worker program in 2011. The library employs 3 registered social workers, who, it says, work in and outside 5 branches, but their impact reaches well beyond the library walls. EPL partners officially and unofficially with community organizations including Boyle Street Community Services, Bissell Center, and Homeward Trust to provide services for people experiencing homelessness, for people with diagnosed and undiagnosed mental health issues, and other at-risk individuals, and to build community. EPL's award-winning program was initially funded by the Alberta provincial government through a Safe Communities Innovation Grant, which not only paid for the social workers, but also paid to provide government ID for patrons who could not afford that cost. When government funding was cut after 3 years, the library stepped in to fund the program itself, although it had to sacrifice 1 senior staff position and some of its equipment budget in order to do so. For many libraries, an in-house social worker program is out of financial reach, but partnerships need not be financially draining. Libraries might consider providing free space to host professional social workers and social work students from local universities, providing services to patrons and work experience for students simultaneously. Likewise, social work interns might be able to provide assistance for specialized projects. Even without such programs, libraries can learn from the social worker model to serve people experiencing homelessness and those with mental health conditions through the lens of educated social justice, and by responding to patrons with empathy, understanding, and lack of judgment.